Here on the Inspirational Health House, we hope to give you inspiration along with health and wellness tips. This can be your go-to motivation hub for nutrition and healthy lifestyle living. We're all about health and wellness. Maybe you will find that motivation you need here on the Inspirational Health House. If you or your loved one is concerned about Alzheimer's or dementia, there are a few things you should know. We'll talk about some of the common symptoms and some ways you can help prevent or slow down this disease. Exercise is considered to be a good way to protect your brain from Alzheimer's and dementia. The benefits of exercise include improving muscle tone, memory and coordination, reducing anxiety and depression, and boosting your mood. In fact, research shows that aerobic exercise helps slow the progression of the disease. It's a form of physical activity that can be done any time of the day. Common forms of aerobic exercise include jogging, playing tennis, swimming, or biking. These activities can boost your blood flow and shore up your blood vessels. According to Alzheimer's Association, aerobic exercise is one of the best ways to reduce the risk of developing Alzheimer's or dementia. It's also believed that regular exercise may reduce the risk of developing other types of dementia. Researchers at Wake Forest School of Medicine studied the effect of exercising on people with cognitive problems. They recruited 296 adults with memory impairment and randomly assigned them to two groups. One group was tasked with performing regular moderate to high-intensity aerobic exercises. A second group performed less intensive stretching and range of motion exercises. Their results showed that these exercises could significantly improve cognitive function. Among all the study participants, the fittest were the least likely to develop ADRD. Specifically, they were less than 20% likely to develop the disease. This is a significant reduction from the usual 40 to 50% risk of developing the disorder. While the effects of exercise on cognition are still being investigated, some studies suggest that the process of exercising can reduce the risk of Alzheimer's and dementia. Some researchers believe that exercising can even halt the onset of Alzheimer's. A recent University of Kansas study also found that exercise could help Alzheimer's patients improve their memory. For example, it is thought that exercise increases the growth of new neurons. There are several types of brain scans that can help with the diagnosis of Alzheimer's and dementia. They are used to assess the structural changes in the brain, as well as to determine the effects of drugs on the brain. The most common scans are computed tomography or CT and magnetic resonance imaging or MRI. CT scans show evidence of strokes as well as atrophy of the brain. MIR scans can also show the effects of Alzheimer's on the brain. PET scans can detect the changes in the brain's metabolism as well as molecules that can help researchers determine if a person is at risk of Alzheimer's. Researchers can also use the tests to test for new treatments that are working to slow down the buildup of amyloid. While PET and MRI scans are used to diagnose dementia, they are not as widely available for routine patient diagnosis. Instead, they are commonly used in research settings. In addition, the costs are quite high. A new study from Washington University School of Medicine has found that a brain scanning tool can be used to predict whether someone is at risk of Alzheimer's. Using this method, researchers were able to detect areas of the brain that were no longer functioning due to the loss of healthy neurons. This type of research is important because it will help develop early detection tools that can help prevent and treat dementia. For example, scientists have discovered that patients with dementia have different patterns of blood flow in the brain. Researchers are also using a new method to study white matter in the brain. These regions are thought to let different parts of the brain talk to one another. The symptoms of Alzheimer's and dementia vary for each person. However, some common symptoms include changes in mood and loss of interest in certain activities. These changes can affect your life and affect other people around you. It's important to get checked by a doctor if you or a loved one are experiencing any of these symptoms. A medical professional can identify the type of dementia and can prescribe a medication to help manage the symptoms. Symptoms of Alzheimer's and dementia can occur suddenly and gradually. When they begin, there can be a great deal of fear. Keeping a journal of symptoms can help with symptom management. Some of the most common symptoms of Alzheimer's and dementia include memory loss, confusion, and a decrease in ability to function independently. These changes can cause problems with planning, following instructions, and taking care of yourself. Many people with dementia experience sudden mood changes. They may suddenly become withdrawn, angry, or frustrated. This change can be a warning sign. People with Alzheimer's and dementia may be unable to find their way home from a familiar place. Other symptoms of this type of dementia include having difficulty understanding spatial relationships, remembering important dates, and losing things. If you or a loved one is noticing the early signs of Alzheimer's and dementia, it is time to see a doctor. There are medications and other therapies that can help manage some of the symptoms, and a doctor can help you understand the disease and help you to plan for the future. Some of the most serious symptoms of Alzheimer's and dementia are delusions and depression. Dementia can be a deadly disease, so you should seek medical treatment as soon as possible. There are a number of medications for Alzheimer's and dementia. They all have some side effects, but they can help with symptoms. If you have Alzheimer's and you are interested in medication, talk to your doctor. Anti-Alzheimer's drugs can improve your cognitive function and help with daily living skills. However, they can also have negative side effects. In addition to the common side effects such as dizziness and sleepiness, you may experience other problems. For example, if you are on an antipsychotic drug, you may develop sensitivity reactions to the medicine. Other possible side effects of medications include vomiting and diarrhea. Some sedative medications can cause sleepiness, confusion, and agitation. You should be aware of all these side effects before you take any medication. A drug called Exelon has been approved by the Food and Drug Administration or FDA to treat moderate to severe Alzheimer's. It works by reducing the amyloid plaques that build up in your brain. The best time to start using this medication is during the early stages of Alzheimer's. Another medication, rivastigmine, is used for mild to moderate Alzheimer's. It has been shown to help with cognition and with concentration. Several other medications are being studied in late-stage clinical trials. These drugs include memantine, an NMDA antagonist, and donepezil, a cholinesterase inhibitor. Memantine may help you maintain your ability to use the bathroom independently. These medicines have been found to be effective in the treatment of several other mental illnesses. They are also safe for people with cardiovascular disease. But before taking any medication, you should always check with your doctor about side effects. If you're a patient with dementia, you may be given an anticonvulsant or anti-anxiety medications. These medications help to reduce agitation, aggression, and restlessness. A dementia care plan is a document that outlines the specifics of a patient's condition. It can be helpful to both the patient and the family. However, a plan should be tailored to meet the needs of the individual, including their abilities. The best dementia care plans include activities that are compatible with the patient's abilities and fit into their routine. They are also designed to reduce stress, which is a key component in helping people with dementia maintain their overall health. Having plan also allows you to make decisions and communicate them to the patient. This can help smooth the way through transitions and end-of-life care. A good care plan includes activities that are both fun and effective. These may include social activities, exercise, and meaningful interaction with friends or family. Caretakers should also consider the nutritional needs of their patients. Diet is especially important for those with dementia. The Alzheimer's Association has an array of resources for caregivers. You can also join professional organizations. Caretakers should also be sure to take time for themselves. Dementia is a huge burden on caregivers. By spending time on yourself, you will be better able to provide quality care. Caretakers should also be well versed in the stages of dementia. This will allow them to know how to help their loved ones during confusion episodes. In addition, they will have a better understanding of the reversible and irreversible aspects of the disease. Caretakers should also learn how to handle stress. Joining a support group is a great way to do this. Identifying other caregivers who have experience with similar situations will allow you to share advice. Finally, a care plan should be designed to meet the needs of the patient, caregiver, and family. It should incorporate the most useful activities to ease the anxiety and promote a better quality of life. If you have any opinions about this video, then feel free to share them in the comment section below. Once again, this is Inspirational Health House. We thank you so much for watching, and if you liked this one, then please hit the like button and subscribe to our channel as well to see more of our future uploads. Thanks again. See you in our next video.